Well, the brain is the most unforgiving organ in the body that you can get away with. We have nothing against the liver, the kidney, or any of those other good parts of you, but you can lose a little bit of those and still the rest works fine. But when people lose a little bit of their brain function and can't move something or can't think or can't speak or can't see in a particular way, that's life-changing. So I think the stakes are high in stroke, that anything we can do to help has an enormous benefit. Any risk is magnified because of the sensitivity of the brain. So I think that's the number one issue, is that we care about every part of the body, but this is an area where even a little bit of damage can be life-changing or devastating for people. The signature at this meeting, although it's not particularly my area of research, is on finding benefits from intraarterial treatment of acute stroke. That's really we're seeing a series of trials that are showing that under the right circumstances and using the right devices, that patients are benefiting from these intraarterial treatments of catheters used to go into arteries and remove blood clots in acute stroke. And that really opens a new avenue that people had been excited about but hadn't had any positive evidence yet to show. So that, I think, will certainly be a major talking point throughout the meeting. My personal interest that's also getting quite a lot of action at the meeting here is on vascular cognitive impairment. So sort of at the other extreme of stroke, not the acute stroke, get them in there, get the clot out in time, but rather a buildup of damage from usually disease of the small blood vessels of the brain. And that's sort of death by 1,000 cuts, that people lose memory over time, that it's become very clear that a disease that everyone thought of as being, it's Alzheimer's disease, almost certainly has a big component of the blood vessels as well. And that's become increasingly a focus of this meeting, the American Heart Association's International Stroke Conference. And we're seeing a lot of improvements in detection and hopefully moving towards treatment studies. That's what we all want. For these intraarterial treatments, it's still a pretty small group of people who actually get it, because it's restricted only to people who get to a big medical center that has subspecialists who focus on this area. Much more commonly has been the giving the clot busters intravenously, the IV TPA, which is effective. That's still a good treatment. It hasn't gone anywhere. It has to be given quicker because it takes longer for the intravenous stuff to get in and do its job. So it really has to be given within 3 or maybe 4.5 hours of when a stroke starts. There's a little bit of a longer time window, and clearly some people who have a clot that just won't be broken up by those intravenous treatments, those are the people who are likeliest to get benefit out of this going into the clot with some kind of retrieving device and pulling the clot out. And for that subgroup of people, this really may be a game changer, and we're all excited at that possibility. Yeah, I would love to say that we're going to stop every stroke in its tracks and go in with a treatment, and that's never going to happen, unfortunately. We've made great strides in that area, and we think we can get larger and larger proportions of people in, but either because people don't know they're having a stroke, or they have one and they're not able to get to a hospital, don't live in a place where they can get to a big medical center, they're always going to be probably the majority of people with a stroke who can't get one of those treatments. And so that focuses on both the before and the after time windows. The before is how to prevent a stroke from happening, and that's the best treatment of all, of course. There's, in our business, an ounce of prevention is worth a ton of cure, so nothing better than preventing a stroke. Or on the other side of the equation, the after, is stroke recovery and rehabilitation. Again, very active areas here at the meeting. We probably don't have any single breakthroughs the way these intraarterial acute treatment, but that's one where we keep getting a little better, and it does add up into improved quality of life for people who've had a stroke.